Like and subscribe to our channel, Fabulous Pattaya Media Group, by using the link below. Early this morning, Thursday, the CCSA reported 20,902 new cases of COVID discovered within a 24-hour period. And that period is likely to be 2 to 3 days ago, as tests have to be carried out and the results have to be collated. In the same period, though, 22,208 people recovered and were released from quarantine. So once again, we have a day when more people have been released from quarantine and recovered than been discovered to have the virus. In the past 24 hours, though, 301 new deaths have been attributed to the virus. And at the current rate of death, we can expect to see over 8,000 in this month. Once again, a quick reminder of the website listing all locations open to expats over the age of 60 or with underlying health issues. These locations offer vaccines for free. It's a long list and has been added to on a regular basis, with a new location, for example, opening for bookings today. Unlike the first and second attempts, this site does work. However, you need to peruse each hospital option to find one with an open appointment date. All are based in the so-called dark red zones, catering currently for expats within those zones. And that website is thailandintervac.com. CCSA figures yesterday showed over 24,600,000 vaccines have been administered to date around the nation. Obviously, some of those are for people who've just had their first, and there are others who've had both. But it's proof positive that the previously beleaguered system is beginning to work now. In the capital, reports show that over 93% of those over 60 or with underlying conditions have been vaccinated. However, to be fair, there's no indication of how many not registered as living there are included in the count. And Chulabhorn Royal Academy has opened registration for anyone over the age of 18. That opens for application today, with 20,000 vaccines available at no charge and said to be available to foreigners. Thailand's Department of Health is recommending that those aged from 12 to 18 who are suffering from any of the 7 specified underlying diseases get inoculated with Pfizer, as the number of actual COVID cases amongst younger people rises. 7,787 cases were discovered amongst those between the age of 12 and 18 in the first week of this month, increasing to 8,733 during the second week. Anyone looking to travel to the UK or Europe is advised to contact their embassies or consulates for current travel advice regarding quarantine on arrival there. The pick and mix plans here, where 2 different vaccines are used per patient, is for sure not accepted as an out for self-quarantine. And Astra from certain countries, not Thailand, is not on the approved lists either. However, the UK does, we're told, accept proof of doses for Moderna, the Oxford Astrazeneca and Pfizer, with the UK's Vaccine Ministry indicating that they would accept AstraZeneca manufactured here in Thailand very soon. By month's end, arrivals in the UK will be able to show proof to GPs of their shot records and have them registered in the NHS system. European countries so far are being less obliging. Real students involved in the almost daily protests in the capital have called for an end to the violence by demonstrators during those events, which are now seen as politically driven, and with a larger percentage of those taking part not in any way students, but there for other reasons. The students themselves have made it clear that clashes with the authorities could lead to more violence, whereas the protests were intended to be peaceful. The nation of Laos wants its workers back. With many here working in construction and now out of work, the Lao government has requested that the Thai government assist in repatriation. Many are here and now jobless, whilst 250,000 have already gone home. This then could add to the lack of building workers in development areas, and could just lead to Thais being offered the jobs, but would need employers to up their rates of pay, which are often lower than the state minimum for immigrant workers. Doubling down is an expression used in gambling, which of course is illegal here, but for one Buriram woman, confusion led to her doubling down on vaccination. Health teams have been monitoring her and seen no terrible side effects after she got her second jab, and then as she waited was taken to another nurse who gave her another one, this time in the other arm. with the turnover of patients blamed for the error, and the lady rather elderly. It was her second dose anyway, and for sure she's doubled her protection. Meanwhile, in our own province, early this morning, Thursday, the provincial offices reported 1,322 new cases of COVID discovered, 312 in Chonburi, 410 in Sriracha, 184 in Banglamung, which includes Pattaya, and the balance spread around the province. In the past 24 hours, 7 deaths have been attributed to the virus. And in Pattaya, the Nongket Noi market in Banglamung is the first to demand proof of both vaccines from all vendors as of the 1st of September. The no shots, no jobs approach is set to protect customers, and it's highly likely that this plan will be passed on to other markets too. And whilst many here, expats and Thais, still refuse to apply for vaccination, it's highly likely that once the rush is over for treatment, maybe in a year's time, vaccine records will become a requirement for visas and extensions of stay in Thailand. And Pattaya's indoor sports stadium car park began to fill again today as the sun rose, as yet another vaccination programme begins for Thais there. Traffic this week has been very heavy on the Soi Chayapruk 2 stadium, and it's proving to be very efficient as turnaround is fast. And with the Met Office promising highs today of 32 dropping down to 30, a sunny and hot day with a chance of rain at some time. Local and national news today from Fabulous 103 FM and Fabulous Pattaya Media Group. And to get a notification every time we release another bulletin or programme,